Janie, they got you over here.
Oh, okay.
Okay. You ready? Or should I wait for Joe? I just don't. Whoa.
What'd you do? The ghost of health meeting staff?
Close the door.
Okay. Good evening and welcome to the Health, Social, Educational, and Environmental Committee. Please rise for the Pledge of Allegiance. Legislator Crowley, will you please lead us?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
All right, roll call, please.
Legislator Crowley,
Present.
Legislator Goulman,
Present.
and Chairwoman Sage.
Present. Okay, so with us this evening, we have the Community Engagement Coordinator for Power Against Tobacco, Molly Franco. She's here for a discussion regarding tobacco retailers.
I have a couple of these, guys. Sorry,
While
I
you're
didn't print
passing-
out enough for everybody. I
Great.
apologize.
While you're passing that out, I will make a motion to accept the addition. Do I have a second? Second. All in favor? Aye. Thank
Oh.
you.
No, this is for you.
No, I don't, I'm good. I got enough paper here if you want.
Oh, do you have it?
No, I'm good, yeah.
Thank you.
So last month, we had a discussion with the Department of Health, and we spoke about the tobacco retailers and the super funds that we have available. And I think Shannon Siegel was speaking too about power against tobacco and resources and discussion items that you might have. And so we thought it'd be great for you to come on a night when we can discuss this further. So welcome and thank you for coming, and I'll give you the floor.
Thank you guys. I'm sorry if you can hear me. This is picking me up. So I do have a presentation, but feel free to interrupt me at any point if you have any questions. I really appreciate the ability to speak today. So you can go to the next slide. So just a little bit about my organization if you're a little bit confused. POWER is a grant-funded program of the New York State's Department of Health's Bureau of Tobacco Control. It's quite a mouthful, but we're part of the Advancing Tobacco-Free Communities grant program. So our job is to take the state's tobacco control initiatives and then fit them into our community work across our catchment areas. POWER's catchment area is Putnam, Orange, Westchester, and Rockland, which is why we have that acronym POWER. It also just sounds really good. It's a statewide program, so no matter what county you're in, you're going to find a program that's very similar to us, wherever you are in the state. They just might have a different name, and we're housed also out of the American Lung Association. They're our fiscal agents. You might see some of their work incorporated with ours as well. And our mission is to protect the health of all people through tobacco control policy, advocacy, and education. And our bottom line is that we believe everyone has the right to breathe clean, smoke-free air where they live, work, play, and I think we can all agree on that. We work on a range of issues: youth activism, smoke-free movies and media, smoke-free multi-unit housing, tobacco-free work sites. We also do a lot of educating of local governments on their ability to enact tobacco-free parks and municipal spaces laws, and then also laws regulating marketing and sale of tobacco products in their communities, which is going to be the topic of the conversation today. And I really think a primary concern of local governments should be advancing the health of their constituents and those that work and visit the community. Commercial tobacco is an unreasonably dangerous product that addicts its users and causes premature death in up to half of those who use it as directed. In communities across New York State, we're seeing more and more smoke and vape shops open on top of the already existing tobacco sellers, so delis, convenience stores, gas stations, grocery stores. And we've really resigned ourselves to the inevitability that these stores are going to open. There's really nothing we can do about it except wait for them to, violate a law, sell to a minor, violate a fire code, and then we can shut them down. But this is just not the reality, and I think a lot of local governments can limit the tobacco industry's control of the environment through evidence-based interventions, which is what I'm going to be talking about today. So I'm going to outline some of these options. I'm not telling you which one I believe Putnam County should do, but just here are the options so that everybody is educated on the subject. So you can go to the next slide. I'm sure you guys discussed all of the rates in Shanna's presentation, but I can just emphasize a few different things here. Putnam County does kind of stick out in a lot of these rates of smoking. throughout New York State. You can kind of see in the metro region, we're one of the only counties with a rate that's higher than the state rate. So the state rate is 12%, we're sitting at 14.7. Not too different, but it is definitely worth noting. You can go to the next slide. This one is also very interesting. This is the e-cigarette use rate. And this is also higher than the state average, not by much. You know, the state rate is 5.3, but the county rate is 7.4. But you can once again see that the rates in Putnam County are pretty higher than a lot of the counties surrounding. Next slide. This is just a graph that I made up examining the different tobacco retailers. This is using the active tobacco retailer map that's put out by the Department of Health. It is updated every year. This is from July 2023, so we'll probably be getting a new one soon. So give or take a few numbers. There's 92 total tobacco retailers in Putnam County. Now, while this is better than a county like Westchester, where I think just in Yonkers there's 270. Yeah, which is pretty incredible. But it's definitely worth noting that in Putnam County we do still have a significant number of tobacco retailers. And I broke this up into two different sections. On the right here you have it by town. There's really nothing too surprising here. You see Brewster, Carmel, and Mahopac have the bulk of the tobacco retailers. It's not too surprising. They have larger populations. That's that kind of goes with the territory that they're going to have more tobacco retailers. But on the left is something I really want to emphasize, and I think when you think tobacco retailers, you're often thinking of the smoke shops and the vape shops, and while those are definitely like a blight on the community, you see them and you're like, ugh, I don't want that on my street, I don't want that in my community. I do want to emphasize that the majority of tobacco retailers are gas stations, are convenience stores, are bodegas, and grocery stores. And those are really going to have a lot more youth access than those smoke and vape shops. We might have a few kids sneak into the smoke and vape shop. What we're really seeing is youth are being impacted by the tobacco marketing in their regular everyday stores when they're buying a Gatorade or ice cream or candy, when they're going in with their parent to pay for gas. So I really think those should also be a focus of retailer policies, not just the smoke and vape shops, which seems to grab headlines and kind of assuage a lot of resident concerns, but they're not really getting to the root of the problem. If you could go to the next slide, please. This is just a map. There's really nothing too special about it, but if you're interested where the tobacco retailers are, I think it's great to use these maps as a tool. You can kind of put flags where schools are, or where parks are, or where playgrounds are, and kind of see how they line up with different tobacco retailers. Next slide, please. So why is a high retail density bad? Tobacco use is a learned and socially mediated behavior. The ubiquitous presence of tobacco retailers gives the impression that tobacco is available, accessible, and welcomed. In 2022, the industry spent $8.3 billion to advertise and promote their products in the retail environment. They do this because increased exposure to the industry point of sale advertising and marketing promotions works. They do it because it works. The more retailers you have, the more you're going to be exposed. Additionally, we have a reduction in search costs. Those are the time, energy, and money that goes into getting these products. When you reduce search costs, you're also going to have increased book rates as well. And increased density can lead to a whole host of other outcomes like increase in smoking rates and reduction in quit attempts. Tobacco control is also a social justice issue. We know that retail density is higher in low-income and minority communities, fueling disparities in tobacco use and its associated health impact. It also increases brand recognition, especially among youth, which increases their odds of smoking. I have a picture on this PowerPoint here on the bottom right. You can tell what that is without the brand name even being on it. Does anybody know?
Newport.
Exactly. You know what it is. Even if you've never smoked them, you don't know anybody who smokes them, you know the color and you know the packaging. It can encourage impulse purchases of tobacco products, cue cravings, and undermine quit attempts. So all in all, retail availability is not great. So what do we do about it? You can go to the next slide, please. Thank you. So this is a great chart I like to use. This isn't making any specific policy. It's not telling you how to do it. It's just telling you what options are there. So on the top left, you have capping the number of retailers in a geographic area. So this basically just means limiting the number that are in, either a zone of the community in the downtown area, however you want it to be. And then also having that limit, so you're being preventative instead of waiting for a bunch of stores to pop up, and then you're like, wait, how do we close them? Then you have in the middle, capping the number of retailers relative to the population size. It's also something that people do, making sure that there's not 5 retailers for every person in the county. You also have requiring a minimum distance between retailers. What does it say when you're walking down the street and there's 3 tobacco retailers and no community center or no outlet for youth? What kind of messaging is that sending to the community? On the bottom left, you have prohibiting retailers from locating near schools and other youth-sensitive area. This is something that a lot of communities are doing and making sure that their tobacco retailers and their marketing is not near schools. Other youth-sensitive areas might be parks and playgrounds. It could be community centers, YMCAs, Boys and Girls Clubs, places like that where youth are often congregating. And on the bottom right is something that New York has already instituted, which is prohibiting the sales of tobacco products at pharmacies. So we already have that in New York State, but you can do it other locations as well. So how do you get there? Next slide, please. So most often these are achieved through 2 different sets of policy options, licensing and zoning. So I'm sure you're both familiar with both of these, but I can take a little bit of time to go over them. So zoning is the primary way in which governments shape the community's land use, whether that be the physical use of the space, the building, or the activities that occur there. And it grants the ability to establish density or proximity restrictions as well. Next slide, please. So once again, zoning is the way that you can restrict the activities that are going on on land. And you can also set conditional use permits. So that can kind of look a little bit similar to licensing when we get into that. So, you can only do this on this property if X, Y, Z. And there have been a few zoning laws that have been passed specifically in Putnam County in the recent months, and I do want to go over them. And while I'm really happy that both of these municipalities have taken the time to address these concerns, I do have a few concerns about the way in which they did it, so I can go through both of those policies. In the packet, you'll have 2 of those sample policies. They're from the town of Patterson and the town of Southeast. If you could go to the next slide, please. Thank you. So the Patterson zoning amendment, this was passed a few months ago. And they passed a kind of funky looking zoning amendment. It does look a little funny just because I think you really have to be from Patterson to kind of understand what they were trying to do here. But basically what they were trying to do was prohibit the sale of tobacco products within their downtown area. If you look at the zone that they did, that seems to be what their goal was. I know that they had a smoke and vape shop open up in the downtown area of Patterson. There were a lot of community concerns. I don't know what happened, but apparently they shut down. I don't know if they violated something or they just shut down for other reasons. I'm not sure what happened there, but it definitely ignited a lot of community concern about these opening in their downtown areas. So hence they passed this policy. They also are not allowing stores where 50% or more of their sales are tobacco or vape products. So that's great. But this policy is not quite ideal because it doesn't really clarify whether businesses are going to be grandfathered into this policy. I went to the public hearing on this and the night that it was passed, and somebody asked the question, well, what happens if somebody's already in this zone? And they all kind of went, I don't really know. They didn't seem to discuss what happened with grandfathering. They just kind of said, yeah, I think that's how that works, but none of it's on paper, so I'm not really sure where that went. So that's the Patterson zoning amendment. Definitely not ideal. I'm happy they took the steps to do something and kind of listen to community concerns and were responsive to those, but I do wish they kind of reached out to their local partners, whether it be myself or the Prevention Council of Putnam, and kind of tried to see what other options were available to them. You can go to the next slide. The next one was the town of Southeast. They did a zoning amendment pretty much within the same couple of weeks as Patterson. They amended their zoning laws as well to just blanket prohibit smoke shops. They define smoke shops as premises exclusively or primarily dedicated to the sale, distribution, or display of smoke shop products. So this policy, with the way it's written, it excludes grocery stores, supermarkets, convenience stores, or any other store that sells these products, and it only targets these premises. But it doesn't really clarify. It just says exclusively or primarily. It doesn't give a figure. Usually in policies like these, you would see 30% or 50% or 75% of sales, but this didn't really clarify. I was a little, surprised by this policy and happy that they really went for it. But I did talk to our Public Health Law Center, which is a law center that we work with to kind of get the legal nerds to figure out if stuff is legal or not. And they said, while this policy is not illegal, it's definitely not ideal. It fails to establish why smoke shops are more of a threat to public health versus other tobacco retailers, so it only singles them out, so they could, basically argue that they're being unfairly targeted, since the businesses that sell tobacco products are not being regulated by this law. So definitely not ideal for that reason as well. So there is a way to do zoning amendments, but I would say these are not the best way to do it. You can go to the next slide. So just to get into licensing a little bit, generally tobacco retail licensing at the local level requires that a city or county issue businesses, new and existing, a license before they're allowed to sell tobacco products. So with this license, they can set their own guidelines and standards for what that business has to do to get that license, maintain that license, and not lose their license. This can be a great tool to monitor the sale of tobacco and nicotine products. By requiring this license, the government is better equipped to control where and whom tobacco products are being sold, and it also grants the power to enforce. So if they're seeing that the county the county health department isn't, able, with the density of the shops, they can, have their law enforcement do it, or have their fire department do it, or have, some other business or some other entity do it. So they can also, it's a good way to keep track of the businesses that have these tobacco retail licenses. That seems to be really difficult to keep track of. And you can also reduce the number of retailers by setting moratoriums on the number of new licenses or capping the number of licenses total. So I can get into a few pretty good examples of nearby places that did local licensing. You can go to the next slide, please. The first is the city of Newburgh. Obviously, you guys are a county, so this would look a little bit differently, but the city of Newburgh enacted a local licensing in 2015 for any business selling cigarettes, cigars, e-cigarettes, so this includes bodegas, convenience stores, gas stations. The eligibility is determined by the city clerk, and violations are enforced by the police department, and the fire department is also permitted to inspect. I think it's also worth mentioning that right now, as it stands, unless you have a separate tobacco retail licensing in place, they can refuse inspection. Any tobacco retailer can refuse inspection from the Department of Health. They don't have to comply with those. It's voluntary completely. And so they have it where if the owners refuse the inspection, the city can get a search warrant if they really want to. It also bans tobacco sales within 1,000 feet of a school's property line, which is great in a city like Newburgh, where you have a little bit more dense property. So it also, this is the key to this policy, is that it reduces the overall number of outlets by issuing only one new license for every 2 non-renewed or revoked. So you're slowly decreasing the number of licenses with time, and therefore the number of retailers over time. So it's a really great policy. It's definitely considered one of the more comprehensive licensing policies. You can go to the next one. So this one is a county policy. This is Ulster County, so also pretty nearby. In 2015, they adopted a licensing policy as well. They made it so that similarly, no new licenses may be granted to a tobacco retailer located within 1,000 feet of any K-12 school in Ulster County. So very, very similar to the policy in Newburgh. It doesn't have that cap, which is unfortunate, but they have a great resource on their own county website where they have maps of the schools. So if you're really concerned about if you want to have a business and you're really concerned about where you can sell, they make it really easy for you. They also have a ton of tools and training materials made available to their tobacco retailers so that they can ensure that they're not breaking any state, federal, or local laws as well. So they did a really great job with their tobacco licensing. You can go to the next slide. So we have a comprehensive, that is also developed by the Public Health Law Center, who we work with. They have a comprehensive tobacco retailer licensing model ordinance. It is a giant packet. It is so long, but the point of it is so that any town, municipality, county can pick pieces within it and kind of construct whatever is going to work best for their constituents and their capacity to enforce. It includes definitions, sample language, public health justifications, and guidelines for procedure, enforcement, violations. So it kind of sets, these are the steps for fees you should do. You should find this on the first violation, and you should do this on the second violation. They're just examples. It's not necessary, but it's just giving counties the ability so they're not just pulling out of thin air and kind of coming up with whatever sounds good. These are evidence-based. So I definitely recommend, and I can email all of you this if you're interested in looking. It's definitely very heavy, but there are pieces of it that I think might be something that Putnam County is interested in implementing, or other municipalities within the county. You can go to the next slide. So this is really it for my presentation. I'm happy to answer any questions, but we can assist. We have these model policies. If you don't think that Newburgh or Ulster County are, we're quite going to reflect Putnam County, you can also I can find other local laws that have passed throughout the state that you might think, fit better with what you're trying to do. You can call us for technical assistance. I'm on standby. If you ever email me and you have a question, that's what we're there to do. And I can also connect you or your attorneys with public health law centers so they can kind of talk law and see what can we do, what's feasible, and what's legal. So that's all I really have for you today. I hope I didn't speak too fast for you all. I hope I didn't take too much time either. I wasn't really checking my time, but hopefully I was good on that. And if you have any questions, I'd be happy to answer any.
I have a question about, I don't think zoning would really apply on the county level because it's home rule. This would be town boards, local municipalities. But licensing is something that maybe the county could approach.
Right.
And I'm wondering if the Atuba fines that we collect can be used to fund some type of licensing program. I don't know if that's your expertise or if that's something that's...
So the good thing about the licensing program, I don't even think you would need to touch the ATUPA funds because you're collecting application fees for tobacco retailers. You have those application fees, and you can also collect separate violation fees. I don't know how that would look in comparison to the counties, those fees that are already set in place by the ATUPA, because it's kind of a different, they're trying to enforce state law versus you guys would be coming up with your own regulations. And a lot of counties, they just codify the state law into their licensing, so it's pretty much an exact, I think the town of Greenberg and Westchester did this. They didn't really change anything, they just codified the state law into their local law so that they had the ability to enforce because they felt that the county wasn't doing that. But so it just allows wiggle room, basically, and then you can collect those fines, have it really be self-funding.
Are there any questions from the committee?
Thank you, Chairwoman. Is this only for tobacco?
Right, are you asking about marijuana?
Marijuana, e-cigarettes, all that stuff? So
Yeah,
it's
so
only tobacco?
e-cigarettes would, be included in this. You would have to make in your definitions, and in the model policy, there are definitions for marijuana, CBD products as well, so you can regulate those as well for your tobacco retailers. Obviously, they're not supposed to be selling like explicit marijuana products. So, but if a licensing law is enacted, it gives the county more authority to go search those businesses. I know that there was legislation that was just passed in the budget that allows padlocking, and it's kind of granting the county to do more searches on their tobacco retailers, but we're not quite sure how that's going to pan out, so we're not too sure on that yet. But I would say, yes, this can regulate all e-cigarettes. You just have to make sure that the definitions are really clear, and that's why the model policy is a great resource because it kind of lays those out for you. The tobacco industry is coming up with new products every single day that are trying to skirt by these rules. So for instance, a new product on the market is nicotine pouches. Technically, these don't have any tobacco in them. They're just synthetic nicotine that's derived either organically or created within a lab. So technically, it's not a tobacco product. Technically, it's just a nicotine product, and it's not a smokable product. So without explicit clarification in a law, those would be included. So like I said, you just have to be really explicit about your definitions. But luckily, with the licensing, it's not set in stone. You can always come back and change and add.
You, thank you. You mentioned in this pamphlet that you passed out, 2021, 14.7% of Putnam County adults, and in New York State was 12%. It's good to compare different time frames. Do you know what it was 10 years ago? I would believe it would be more than it is now, because the current laws that are out there are working effectively.
Right.
Do you happen to know what it was 10 years ago?
No, I don't off the top of my head, and I can get those numbers for you. From what I understand, the rates were definitely higher in past decades, and they have gone down significantly. But I will say that it is worth noting, one of my partners at the Center for Tobacco-Free Hudson Valley at the Public Health Summit also mentioned this, that the rates in Putnam have oddly enough gone up We're not quite sure why. Going from pre-COVID, post-COVID, you can draw your own conclusions about why that might be. But we have seen a significant increase, whereas Putnam used to be, just a couple years ago, kind of on par with Westchester County, not too far different, and now they're way surpassed that rate. So I'm not quite sure the reasoning there, and I don't want to disparage anybody at the health department because they are doing amazing work with their cessation program, so.
You're
Not really
saying
sure
that the
why.
rate went up after COVID?
Yeah, in Putnam specifically, yes.
Well, alcoholism and a lot of other things,
Right.
drug use all went up because,
Right.
you know, the pandemic was not a favorable thing to anyone, you know. 10 years ago and even 5 years ago, tobacco was more available to everybody, minors, adults. You were able to go to a bar and get cigarette machines. You were able to, you know, a minor could go in and get a cigarette. So I think right now it's actually the retailers are doing a good job. So to regulate them more than they already are might be not the best thing for retail, you know, in Putnam County and New York State, actually. Currently, the state laws, the county can't enforce those laws, correct?
County can enforce them?
Yeah, yes or no?
Yeah, the county health department can enforce the state laws.
Okay.
And the sheriff's department also uses the TIPA funds for overtime to go out and check on all of these establishments that are breaking the law. Legislator Crowley.
So I know we're saying adults.
Yes.
Fun question. How many, do we have any statistics on realistic numbers on what the actual usage for adults 18, is it 18 or 21 now to purchase tobacco?
To purchase tobacco is 21, but I think the adult
So
use rate is
realistically, do we know that youth kind of range and if that's bringing us up? Because I feel like if you talk to the youth, they think cigarettes are disgusting. It's gross, they smell. It's just not, it's a different time frame. But if you're looking at it, that's a lot of what you see is these young kids that are vaping, that are using these different types of tobacco. Do you have any numbers on that?
Yeah, I don't have those numbers offhand. I don't have them for you. It's also really difficult, I will say, to get really localized data on this. I can always get the statewide rates for any kind of more specific population breakdown, but these more localized rates are very, very difficult to get. There are a few resources from the Prevention Council. I know that they collected a lot of information on that, but even then, a lot of the questions are kind of, have you used in the last 30 days? You know, that it's not really a continuous, are you using this product regularly within the last 6 months? So.
Well, they're also all adults, right, when they're purchasing it?
Yeah, so yeah, we also are not quite sure how youth are getting these products, whether they are buying them illicitly from, you know, gas stations, bodegas, smoke shops, and that's what's happening. We have a TUBA funds to kind of prove that that is happening in Putnam County. But we also have, you know, older siblings and even maybe, you know, older adult relatives who are purchasing these products for youth, and that's really unfortunate. But I think the goal is to really just get the numbers down bit by bit by bit by bit.
So Kristen McConnell has been to our meeting and she's given us numbers, our local numbers before, and she does have it available, and she does
Right.
it through a survey through the schools.
Yes.
But when my son was in middle school, this was starting out huge. I mean, middle school, this is 12, 13, 14-year-olds. So it's pretty prevalent here in Putnam County. And as I recall from Kristen's presentation, back then, Putnam County still had high rates of vape and smoking, even in the youth and adults. Legislator Nasarino.
Hi. Well, remember years ago, Putnam County was on the cutting edge when they banned tobacco in public places,
Yes.
like restaurants and public.
And we raised the
public places, right? And we raised the age. I do represent the town of Patterson. I can attest to their downtown area is really not a downtown. It's really just a small rural hub. But it does border a residential neighborhood. It does have, the school is within very close proximity. It's on the library and the town hall. I will certainly convey your comments to them because any zoning ordinance put in place can always be amended and improved upon. That being said, I don't think off the top of my head that we have any pre-existing vape shops in the town of Patterson, which is why that probably would be a moot point. There's nothing in the central area or where there's any retailers, very little retail to begin with, or stores. But I do have a question. pertaining to licensing, because the examples you used were actually municipalities and cities. Licensing on a county level would certainly require, and how does that affect home rule? I don't have a copy of any of that, sorry.
I'll make a copy. There's a licensing for Ulster.
Thanks.
I'll make-
Okay, so also, but how does that affect home rule with the municipalities? And then we
Yeah.
always come to the decision when we do something like this of what it would entail to hire employees and who's going to enforce it and what fees are going to be set and what that impact is on government. So I don't know if you could speak to that from your experience, and maybe Ulster's a fine
Right.
example.
Yeah, so Ulster County does have that policy in place as well, but like I said, with their licensing policy, there really isn't too much to it. It's just having that they're registered with the city, so it's really just going to, the same way you would register any business license. It's a very similar process, and submitting the funds for that. And then also when it comes to home rule, I believe the county law would take precedence over, would supersede over any local municipal policy.
But what's the function? Because when we do that, people just think they're money grabbers. So we're collecting fees.
Right.
We're not really
It's
enforcing.
like a liquor license.
Excuse me?
It's like a liquor license, if I may, sorry.
It is, but when we add layers and layers of that, so you need.
Yeah, that's definitely, I would consider that's definitely a consideration that the county would need to take, especially just how it would impact, and you mentioned it earlier, how it would impact relationships with store owners. You don't want them to feel like Big Brother's watching them constantly, but it's kind of, you gotta weigh the pros and cons of making sure that we're capping the number of retailers we have now and kind of plugging the hole before it gets too out of control and we can't control them. We're kind of retroactively trying to get them out of our municipality and being more preventative.
Through the chair, I think I would advocate for like a stronger zoning ordinance put in place where the local municipalities can really oversee and enforce on that level, rather than getting into the whole licensing and not having really that enforcement of it, just collecting fees for the licensing and having a spreadsheet on it. I think that could be done at the local level, but that's just my opinion. Thank you for
No,
coming
thank you.
tonight.
I appreciate your
Very
input.
informative.
Legislator Elner.
Thank you, Chairman Sage. If memory serves, Putnam County, we were once again the healthiest county in New York. So with this data indicating that we're having increased tobacco use, what's the dates that this data was compiled?
So this was published just last year, but I believe the data specifically is from 2021. But I would have to get back to you on that. That's when it was collected. So it is post-COVID, but.
Through the chair, I'd be very curious to see if the trend, if our overall health is decreasing directly with the increased
Right.
tobacco use.
Any
If
other?
I
Legislator
may,
Montgomery.
I think, it would be great to keep an eye on it. Does it look like Ulster just passed this?
Oh, no, that's because I
Okay.
printed it today.
Okay, that's when you printed it, but it'd be interesting to find out what added manpower they needed for their
Right.
licensing, if we could keep an eye on that
Yeah.
and get some data on that. But, I mean, I think overall, it sends a message that we know as a society that this is bad and costly, smoking, and it costs the county money in the long run because our population is really, will be unhealthy if we don't continue to send the message. And I think it's more of a message we're sending, to combat this, what can be a crisis, what, ultimately leads to really poor health. So it was a really great presentation.
Thank you.
I appreciate it. Thank you.
Thank you for your input.
And I'm wondering if the tobacco licensing would support the towns. Maybe the towns, maybe feel a little overwhelmed. Sometimes
Yes.
if there is a licensing and they know that the county has their back as far as shutting them down and inspecting, and if they can't locate within 1,000 feet of a school, or, it just gives them
Yeah.
a little more
Sure,
support.
they would
Right.
find that out for their zoning, any consideration.
Yeah, I would
takes
hate to
takes
supersede
that
the town
into
zoning. I would hate to
They
do that,
take
but-
that into consideration, what the adverse effects would be of any potential entity moving into a town.
Right, especially with gas stations.
Yes.
Oh, that's their problem.
Is there any sort of permitting needed, I mean, like if you open a gas station or any, there's no sort of
They have-
permitting, or they just check a box and say, hey, we're
They-
selling this?
Yeah, so they have to apply for their licensing for both, I believe it's both cigarettes and vapor products. They have to apply for, with the tax and finance department.
So there is
that's-
already something
so-
in the works that there's a tracking mechanism through the state that they are there. So it could be just brought in, and again, I mean, if you're opening up a store of any kind, you're on, Big Brother's watching you, to whether it's expiration, alcohol, weights and measures, whatever it may be, what kind of business you have, they're overseeing what's going on to some degree. So you're
Right.
taking on that liability as a business owner. And I think ensuring our youth and our population's health should be of the utmost importance on top of operating a good and fair and equitable business that is good for our population.
I agree. And what I'll say about ATUPA is ATUPA is already doing these inspections. Obviously they're limited. They can only probably do them a couple times a year, and then you have the two different types of inspections. The monitoring the youth sales, and then also just monitoring whether they're selling flavored products, which is also an issue. That's really the bare minimum, is what I'll say, when it comes to monitoring and making sure these policies are making sure that they're following, laws that would be beneficial to public health. It really is the bare minimum. And same with having to register. They're really only registering with the tax and finance, and then the list that I got for the results today is really a compiled list from ATUPA, from different ATUPA agencies around the state, and they're compiling their numbers about what they've collected, and that's really all the tracking mechanism there is.
Just
Just have one more question. Wasn't there some policy of some sort put into place regarding the visuals walking into these entities, whereby now cigarettes are behind the counter for the most part, and there wasn't that blatant advertisement that would lure children in or make it seem like an attractive thing to do? Has there been any more
Yeah,
to that?
so what I will say, there have been changes definitely that are made, where you have these products behind at a power wall, behind the register, and they're all kind of compiled there, and trying to not have them out in the open where youth or just people can access them easily. So that does exist, and then additionally there are, you might even notice them if you go to different either the grocery store or other gas stations that are chains, any one of those that has a promotional program with certain tobacco companies like Philip Morris or any of those big ones, which most of them do, offering coupons and buy one, get one free and anything like that. They have to have a sign now that has, there's like a list of 30 different facts. But this is something that was actually implemented after, it was implemented in the early 2000s. It was passed that they were required to do this, and hasn't been implemented until just this year.
Right.
So it's really a slow go, and since then, so they had to be required to put these notices up. It has no mention of e-cigarettes because they didn't even exist yet when it was passed. Advertising is really, really tricky to go after, and that's why I didn't really mention it in this presentation today, because it becomes a free speech issue. There have been policies that have been passed in the state before, trying to limit tobacco marketing specifically. But those are, kind of get in a touchy territory when you're talking about free speech and the ability to advertise, and so it's a bit tricky there.
Thank you.
You're welcome.
Any other questions? Legislator.
Thank you, Chairwoman. I don't think licensing is the right thing for Putnam County at the moment. You mentioned that there's 92 retailers that are selling tobacco products in Putnam County. The reality is the sheriff's department can go out in 2 days and inspect each one of those with sending a minor in to see if they are selling them a product, or even walking in and see if the tax stamp is a New York tax stamp or a North Carolina tax stamp or something of that nature.
Can I pose something?
What?
Can I pose something? What if in 5 years it's not 92? What if it's 202? And then departments can't do it anymore, they're at their capacity.
Well, right now it's 92, and in 5 years, the legislature could look at that time if there's 200. Like you mentioned before, it is a burden to small businesses to make sure everything is, this license, that license, there's a cost to that. We can enforce that, and the sheriff department does enforce that. This is not Putnam County, but I know a retail store right on the border in Yorktown, right next to my district, lost their license temporarily because a minor sold cigarettes to someone else. I mean, a minor bought cigarettes from someone else, and the reality is, it was a minor who sold the cigarettes. So, the laws are being enforced. To put more of a burden on, I think, would be too much for a business person.
I appreciate your perspective.
Anyone else, anyone from the public? Thank you, Molly.
Thank you.
so much.
Thank
It's
you
great
all. And if you
information.
have any questions, please email me. I'd love to, chat about this more,
Yeah.
off the record or.
Can you get back
come
to us
for
on
it.
what the tobacco rate 10 years ago was?
No, I don't have that
No,
offhand.
can you get back to us?
Oh, yes, I will, absolutely.
Thank
I'll get you even, I'll make a little nice pretty graph, see if it goes up and down, see what
Yeah.
it looks like.
In the
Yeah,
prevention.
And I think the Prevention Council
President,
has
yes,
that.
also has their
Yeah,
data.
yeah.
Those are,
Kristen McConnell.
Yeah,
Yeah.
I'll
She's got
connect
all
with
that.
Kristen and get that from her as well.
Yeah.
Wonderful.
Yes, I apologize, I should have brought more.
We
I
can
really
make
apologize.
copies,
You can-
we can make copies at
I'll look
the.
up-
And I will email all of them to you too if you want to access them
I'm just
electronically.
interested in the Ulster and I can find it online, so.
Thank you, Nancy.
Yeah, thank you.
Thank you
Appreciate
all.
it.
Thank you
Thanks
so much.
for coming out. Okay, next on the agenda, we have with us our Commissioner of Mental Health and Sarah Sergio for an approval to establish a mental health petty cash fund for the Department of Social Services. I
Hi.
can't believe you guys don't already have one.
Don't, no.
So anyway, I'll let you,
So we do have a petty cash on the social services side, but mental health does not.
Okay.
So we're asking for a very small amount just to see how it goes. We spend a lot of money, our own money, because quite honestly, it's a task to get reimbursed for things like McDonald's or when we're trying to engage someone, help them feel safer, more comfortable. Often it involves food, it involves a new shirt, whatever it is. So we're just asking for $100 to start, so that's why I'm here.
okay. I spoke with our auditor, Michelle Sharkey today, and she said it's pretty typical. You turn in your receipts, goes to a voucher, it's replenishing the fund, it's
Yes.
pretty straightforward. And I think we also have attached a resolution from another department, based on another department, so I think it's pretty straightforward. Does anybody have any questions?
Through the chair, is 100 sufficient?
No, but we will,
Yeah.
That's
we
why I
will
was gonna say
start
250.
with that. So we've got some funds within the department to play with and to fill it back up when we need to. It's really just, we need that cash.
That's okay. I mean, I bought a sandwich and a iced tea today that was $23 plus tip. So that would go really fast. We had a family and that's health crisis.
You can establish that during budget season. You'll establish a different, maybe,
Yeah,
pocket.
we will.
Yeah.
Yeah.
Book.
Okay. Anyone else have questions? Anyone from the public? All right, so I will make a motion to approve the establishment of a mental health petty cash fund. May I have a second? Second. All in favor? Aye. Thank you.
Thank you,
so much for
everyone.
coming out.
Thank you.
Yeah, okay, number 5 is other business. I do not believe we have any other business. I'll move on to agenda item number 6. I'll make a motion to adjourn. Second. All in favor? Aye. Thank you.